Good evening, everyone. Let me introduce myself. My name is Nimi Geotaliat. I am an MIT student in University of Melbourne. My topic for the technology evaluation project is CHF home monitoring. Before entering into the presentation, let me give an outline. This presentation consists of an introduction, evaluation of technology, success story of implementation, proposal of the implementation of this technology in Australia, conclusion and references. So, as we all know, chronic heart failure is a life-threatening condition and it can lead to sudden death of people. As per the Heart Foundation website, it states that around 300,000 Australians are affected by chronic heart failure and it kills more than 2,500 each year. Like diabetes, asthma, etc., this condition will be with the patients for their entire life and it causes daily challenges to their lives. But chronic heart failure can be managed more effectively by controlling the symptoms of heart failure and avoiding unnecessary hospital visits by working in partnership with the healthcare team. So in short, CHF home monitoring is an advanced technology that helps the healthcare team to regularly monitor these patients and to detect and treat the symptoms at the earliest. It provides immediate responses from healthcare team and also tries to prevent the symptoms from worsening. Now let us evaluate the technology. In the earlier days, at first the telephone-based interactive voice response system was developed, which obtained the weight and symptom information and conveyed it to the healthcare centers. But it did not provide significant benefits over the usual care given to heart patients. The new technology involves transfer of physiological data such as blood pressure, weight, electrocardiographic signals, blood oxygen level, etc. automatically through wireless networks. This technology is smartphone based and it also involves the application based support. It is relatively inexpensive compared to other dedicated home monitoring hardware. The implantable devices like permanent pacemakers, implantable cardioverter defibrillators, they were all tried and they all proved reduction in time from event to clinical decision because they can record the event or the heart related problem. But there is no evidence until now that it caused reduction in hospitalization and mortality. So in short, CHF home monitoring technology, it seems to be a very good technology and it becomes efficient only if it can incorporate the right collection of data, reliable transmission of this information and integration of this information to the busy workflow. Now, let us see a success story of the implementation of this technology. Northern Arizona Healthcare in USA, they decided to conduct a pilot project named Care Beyond Walls and Wires with 50 patients suffering from congestive heart failure. San Diego telecommunications company called Qualcomm was the leading project company, accompanied with Maryland-based Cepheid Technology and Verizon to provide smartphones and remote monitoring hardware. This was a 16-month project and it started in December 2011. Patients involved in the project were given scale to weigh themselves, blood pressure monitors, pulse oximeters, and also smartphones with the technology to stay connected with the monitoring team in Flagstaff Medical Center. By December 2013, the project was finished and the University of Arizona released an article that stated the success of the project. Jane Erickson of the University of Arizona on December 17, 2013 released an article, and from this article it is evident that the project was a great success. It included face-to-face interview with the patient and the clinicians who were involved in the project, and it reveals how it was beneficial, especially for a remote living patient. Now, the good and most exciting news is that this technology has been proposed in Australia. Technology vendor MedTech Global and Peninsula Health, in association with CSIRO, has been promised full funding for the full trial of CHF home monitoring this year as part of Victorian Government's Health Market Validation Program. Their plan is a trial for 18 months, and it will involve 300 patients. Half of them will receive standard care, and the other half will use MedTech's VitalMed software on their mobile phones to track and monitor their weight and daily activity levels. Now let us see what are the inclusions of this CHF home monitoring technology which is proposed in Australia. A Bluetooth enabled scale to collect weight measurements and send to the cloud-based Manage My Health portal of MedTech, which can be accessed by clinicians. MD Analyze software to analyze the clinical data and make improvements in treatment plan. It also plans to involve prompts for the patients if there is some abnormality in their weight measurements, and also the healthcare staff can contact them in such situation through VitalMed software. It involves Peninsula Health's MePAC's personal alarm emergency response service in case of abnormality in the weight reading. It involves chronic heart failure clinic supported by cardiologists and cardiac nurses. It plans to add data from wearable devices such as Fitbits. It aims to use the audio-video capability of smartphones to educate the patients and carers on how to use the system. All the information recorded by the system will be gathered automatically and transmitted to the healthcare centers. Manage My Health portal of the MedTech can be accessed by clinicians and staff at MePACs. They monitor each individual patient and contact them if needed using the VitalMed software. They plan to include the GP by integration of the personally controlled electronic health record and grant access to the GPs to directly log on to Manage My Health portal. They also plan to include the dashboard for easy view of patient data. It has all key clinical information relevant to the routine management of patient. It provides one-click access to many of the forms required for the routine management of the patient. It also involves an algorithm developed by CSIRO to inform them if the patient is in danger. In short, let us hope this trial of MedTech's CHF home monitoring in Australia will be a great success. Now, to conclude with my presentation, chronic heart failure is a fatal condition, and we see that it affects a large number of people around the world, especially elderly citizens. CHF home monitoring is a technology that helps to regularly monitor the patients who are once admitted to the hospital due to this fatal condition in a cost-effective way. It monitors daily activities, medication compliance, and symptoms and signs of the disease. It improves the quality of life of these patients. It reduces rehospitalization and related costs. There are more areas to investigate, such as patient medication adherence, testing and monitoring of biomarkers, etc. Also, monitoring itself would not ensure the efficiency of the system. Regular and systematic follow up is also an inevitable part of the system. But above all, this technology gives confidence and secure feeling to patients by rendering a feeling that someone is caring them consistently. These are the references for my presentation. Thank you.